Hey everybody, it's Matt Shu from Upright Health, and today I want to talk with you about thoracic outlet syndrome. This is a topic that's pretty near and dear to my heart because for many years, starting from kind of the second half of college and then going into my mid-20s, I ended up with a lot of problems with my hands, wrists, my fingers, even the nerve coming here along my elbow, the ulnar nerve. And I had a lot of shoulder issues and even a little bit of neck discomfort playing all into that. And I struggled with that for many years. I was reassured that, hey, don't worry, it's not carpal tunnel. So what you have is a repetitive strain injury and just chill out, relax, don't use your hands anymore. That was really difficult advice to follow because I don't know how I can get through life without using my hands. Now, quick review of the idea of thoracic outlet syndrome. The idea is you have this area here just under the clavicle that can basically get shut off. It can just get clamped down as your shoulder blade rolls forward too much, as your shoulder comes into this horrible computer position that we're all so used to. Once you've allowed this to happen, you narrow a space where blood vessels and nerves run, and that cuts off sensation into your fingers. It cuts off blood flow for many years. In fact, actually you can see probably better right now on this arm. With this arm, you can see I actually have quite a bit of venation. It's not super pumped up because I haven't done anything to make it all pumped up, but you can see there are blood vessels right here. Also on this arm, you can see I have blood vessels on this arm. Okay, and they're generally pretty visible. So on me, that's just how I have been genetically. But through many years, my hands would be really cold. They'd get numb, they'd get achy. And the most noticeable, disturbing thing to me for a while was that you couldn't see any of my veins. They had just basically disappeared. Now, a lot of treatments for thoracic outlet syndrome that I've seen involve massage, and that's fine. Doing some things to try to massage your chest, your anterior shoulder muscles seems like a reasonably good idea because that should help reset the shoulder. But there's just not a lot of attention that's paid to actually training to get the shoulders back in the correct place. That is extremely problematic. Now, what ends up happening is if you go through, say, PT and they do some massage work on your neck and on the front of your shoulder, and it doesn't fully fix your problem, then you're told that basically your best option now is surgery. And that, reading some of the stories that I've read online of people who have survived that surgery, doesn't seem like such a good idea because you're not only removing an entire bone, or at least part of a bone, the first rib, you're also cutting into muscle. There's things where they will cut the scalenes, which you have those muscles for a reason, and then they will cut the pec minor. They'll just cut and get the tension to relax that way. And while that is an effective way to make a muscle less strong, I don't think it's a smart long-term decision. And then I've also read stories of people who are then on pretty strong nerve painkillers for years and years following that surgery, which doesn't seem like you're actually accomplishing what you would hope that surgery would accomplish. So I want to be clear, if the surgery worked, then fantastic, that's wonderful. If it gives you full function, that's wonderful. But I think this illustration I'm going to show you with a piece of metal, a pipe, and a box should help you understand why it's probably not the most effective idea. So this piece of metal is going to represent your clavicle. This piece of pipe is going to represent a blood vessel. And then this box will just be a rib, okay? So this blood vessel passes between the first rib and the clavicle, like that. Now, I'm going to ask you to pretend that this pipe is more like a hose, right? Because we don't have really rigid blood vessels. Our blood vessels can be closed down pretty easily just with a little bit of pressure. So imagine this is like a little hose. If we have this bone, the clavicle, on top of it, and then we have the bone, the first rib, under it. If we apply a pressure down, we are going to make that hose stop flowing, right? The liquid in that hose is going to stop. So if we can take pressure off of the hose, it's going to make things a lot easier, right? We're going to get blood flow through here again. Now, just think about this in your backyard. Let's say you have something sitting on top of the hose that's blocking the flow of water. Is your solution going to be cutting the ground underneath the hose in order to ensure that liquid can get through your hose? Unless you're a really unique individual with probably a chainsaw or a jackhammer or just some anger issues, you're probably going to want to remove the thing that's on top, right? You want to get the pressure off of the thing on top of the hose so that that hose is allowing liquid to flow through again. In the case of surgery, what you're instead doing is removing the ground, which is obviously impossible in your backyard unless, again, you have a jackhammer. And you're cutting some of the muscles that help maintain proper position. So instead, what makes more sense is to do things that lift that clavicle out of the way and that create more space. And so this is where strength training comes in. This is where looking at the problem as a muscle problem instead of a bone problem can be much, much, much more helpful. Right? So the clavicle, you can easily depress the clavicle, right? It's really easy to make the clavicle go down, right? I can use muscles to pull it down. Pec minor is involved. I can use my traps. I can use my lats. I can use muscles to pull this down, and that actually closes off the blood flow, right? I can also roll it forward. Again, pec minor is involved. The pec major is involved, and serratus can be involved. Serratus anterior can be involved. I'm pushing in here and then down. Now I've really created a problem. Now I can really, really clog up the blood flow, and I can clog up the nerve transmissions, right? So if instead I can use opposing muscles well, and if I can train them to be strong enough to get that shoulder back into a better position, I can effectively lift this up and off of the hose so the hose is allowed to function the way it's supposed to. That's much, 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 much less invasive than going in and cutting the ground out. There's much less risk if you can, for example, do things like shrugs, if you can do things that elevate the shoulder while still maintaining proper shoulder blade position. That's going to be something that's going to help rather in the long term and the short term, right? What we're looking for is a solution that actually positions the shoulder better so there's no more occlusion of the blood vessel and the nerves, and also doesn't involve reliance on medication for several years or several months, that increases your function, that allows you to continue to do things that you want to do. In the case where you cut the ground out, where you cut the rib cage, you cut muscle, a lot of people find that they are unable to do the things they wanted to do in the first place. So while the surgery may have changed the nature of their suffering, changed the kind of pain they're experiencing, and maybe relieve some of the blood flow issue, it doesn't give them the ability to do the things that they want to do, unless, some people do get lucky and it does turn out okay, which great news for you. But for those who run into these problems of residual pain that just doesn't go away, it's important to realize that it's going to be a question of retraining muscles to do their jobs correctly. If you never fix the muscles, if you never train muscles to do the right thing, if you just remove a piece of ground here and this is still crushing down, you're probably not going to be happy. And if the muscles themselves are the things that are complaining, if you actually feel pain in muscles, then no amount of removing of bones or of slicing nerves, none of that is actually going to help you until you actually get the muscles happy and capable of doing the jobs that they need to do. So I hope this example gives you a different perspective on thoracic outlet syndrome surgery, gives you a different perspective on what might be an appropriate approach. And I hope you remember that pain sucks. Life shouldn't. If you like this video, be sure to subscribe and check out some of the other videos and programs that may be able to help you.